To select adequate packing, labeling and marking as per IMDG code, to effect a proper stowage and lashing of goods within the containers. Duties of forwarding agent are to check with the shipper that stowing and securing of goods in containers are in conformity with IMDG code and maritime requirements, to obtain approval of inland transport from local and national authorities, to draw up dangerous cargo manifest according to IMDG code, to control labeling of containers, to give instructions to stevedore and port authority and full documentation like shipper declaration, dangerous cargo manifest, etc. Duties of stevedore are to stack container in dangerous cargo terminal as a stacking area waiting for shipment, to obtain instructions like stowage and base plan from line operations center, to handle with care container to avoid bumps, shocks, in order not to jeopardize securing of cargo. Duties of ship's manager are to check with the forwarding agent every units of dangerous goods, to obtain approval of loading from port authorities, to check the type of container is appropriate to carry goods, to build up ship's stowage in respect with IMDG segregation table of non-compatible stuffs, to instruct ship's staff accordingly. Duties of the ship's staff are to check containers lashing with the operation center prior to departure, to effect daily checking of container condition and lashing, to inform crew of the stowage plan regarding location of bays with dangerous cargo or hazardous cargo, to have a safety drill accordingly based on information on hazards incurred, chemical reactions to water, foam, carbon dioxide, heat-emitting dangerous gas, suffocating smoke, etc. To instruct when at K, port authorities and safety.
I'll just come. One second.
Guards of the loading on board of dangerous goods like bunkers blazing at risk.
In this media, you will learn about different injuries occurring to the eyes. In case of any LNG contact or spillage, the eyes are affected very much. The harmful exposure results in irritation, tears, and burns in the eyes. In case of such eye injuries, it is good to rinse the eyes with water, and then proper first aid measures must be followed. Thus, you have learned about the eyes. Food pyramid indicates the essential foodstuffs to get adequate nutrition.
This is saying how water will form the base of the pyramid, and C as the requirement decreases over the pyramid.
It is advisable to take these foods based on a recommended number of servings. Foods at the bottom, like grains, have highest number of servings as well as nutrition. Food at the top, like chocolates and junk foods, are considered as non-essential and have fewest number of servings. Food at the middle should be taken in the recommended servings. The order of rows in the pyramid refers to the quantity of food consumed on a daily basis to get a nutritionally balanced diet.
Frost injuries.
In this media, you will learn about frost injuries. The main cause of localized frost injury is negligent handling of cranes and pipelines carrying cold gases. The first symptom is pricking feeling on the top layer of the skin, followed by white spots on the skin. Use warm water to thaw frozen hands and feet. Do not rub or massage the frozen skin. Use soft wool fabrics to cover the frozen body parts. Thus, you have learned about frost injuries.
Okay. This is about this. I think I've already shown you. Immersion now. What do you do if there is a...
The media gives knowledge about the stages and effects of immersion. When the person falls into cold water, their body's initial reaction is a gasp reflex, which can include hyperventilation and muscle spasms. This initial reaction can result in water inhalation, as well as significant changes in heart rate and blood pressure. A person will lose the ability to swim, and hands quickly begin to lose strength and sensation subsequently. The person's overall body temperature will continue to drop until it has reached the same temperature as the water. Hypothermia symptoms range from mild to ruthless as the body's core temperature falls. A person will eventually lapse into unconsciousness. A drop in blood pressure, which may lead a person to become unconscious or to stop breathing at the point of rescue or up to several hours afterward. In this media, you will learn about the consequences of consuming poisonous materials. Inhaling poisonous gas or dust, skin absorption, swallowing of poisonous gas or fluid, and so on, come under intake of poisonous materials. Based on the type and the quantity of the material, the reaction differs. The poisonous materials first affect the brain
I can't see the
and
video.
stop the oxygen flow. It results in unconsciousness, and sometimes it leads to death. Inhaling poisonous gases results in absorption of poisonous gas by the blood and affect the lungs, nose, and throat. Through skin absorption, the blood quickly absorbs the poisonous gases and fluids. If the poisonous gas or material is swallowed, the mucous membrane in the mouth absorbs it quickly. Thus, you have learnt about the consequences of consuming poisonous materials.
This video is about
This
suturing.
media shows us the methods of suturing techniques which can be used for dermal wounds or cuts. Here are the materials or surgical instruments which are required for the purpose of suturing. First, suturing needle. A forceps to hold on to the needle. A tissue forceps and scissors. Now, we can go on to interrupted suturing technique. We have dermal layer to be sutured. The needle and the suture are taken with the help of the forceps. First, the needle is punctured and a knot is made at one end of the wound. Then, another knot is made at the wound. This is an interrupted simple suturing method. Now, we can go on to continuous suturing technique. We have dermal layer to be sutured. First, take the needle and suture with the help of the forceps. Now, tie a knot at the start of the wounded area. Then, insert the needle onto next step. Few millimeters, insert needle as you sew your clothes. At the end of the wound closures, now put another knot at the end of the process and cut the excess of suture.
IV therapy.
This media helps us to get a knowledge about intravenous line. There are things needed for starting intravenous drip. First, look at selecting an appropriate vein. Applying the tourniquet to impede venous return and engorge the vein. Cleanse the selected area completely with alcohol swab before the catheter insertion. Insert the catheter bevel up at around a 30-degree angle from the arm. Retract the needle and simultaneously remove the hub. Apply the sterile normal saline to the hub, and then put on a bandage to keep the hub in a stable position. Now, adjust the flow level of the normal saline.
These are small videos about all these narcotic
Amphetamine
drugs.
is a stimulant and an appetite suppressant drug which people most commonly abused. The metabolic pathway of amphetamine drug is. The effect of amphetamine is.
Take a screenshot of this. These are telling the effects of amphetamine. Okay.
Anabolic steroids are legally prescribed drugs for the hormone deficiency. And it can also be used to build the skeletal muscles. The side effects of
Take a screenshot of this. These are like balding in men and women, face, hair on the face and the chest, deepening of voice, high cholesterol level, liver dysfunction. Okay, so these are the changes that happen.
Anabolic steroids are cocaine is a powerfully addictive stimulant drug. The chemical structure of cocaine is. The adverse effects of cocaine are.
Take a screenshot of this.
Marijuana is a common illicit drug used by some adolescents. The chemical structure of marijuana is. The side effects of marijuana are shown.
Mostly muscle cramps are a very bad problem, and that is why the urge is always there, because these are addictive drugs. Okay. Morphine is the last one.
Morphine is a narcotic pain reliever drug. It is obtained from opium. The chemical structure of morphine is. The adverse effects of morphine are.
With this, I finish all my collection of the STCW videos and the DG website videos. We'll just take a small break and join back. Jeet, I will be needing your help after that. Whatever is remaining, we'll see from the website now. Okay? Yeah. Okay.